Crystal Ball. Thank you both for being here.
Thanks for having us, Rob.
Congressman, let me start with you. The president offering an honest assessment of the problems with the law while Boehner calls for total repeal. Let me give this to you, Crystal. Are these guys serious? He's giving an assessment of the law. They're saying repeal.
Yeah, and that's what they've been about from the beginning, which they know, I mean, cynically, they know that they can't repeal it because the Democrats hold the Senate, the president is in the White House waiting to veto it, but it's the thing that feeds their base. So they keep saying repeal. And the part of this that's really cynical and the part that Republicans have never addressed is, let's say that they did magically get their wish and this law was repealed. What are they going to do about those millions of Americans who don't have health insurance? And that's what they've never answered. So they have all this faux concern for the people whose rates are going up or who are getting cancellation notices, with absolutely no concern for people who are denied coverage because of pre-existing conditions, or who have coverage or think they have coverage, but when they actually get sick, find out they didn't have the coverage that they had.
That is what is the most outrageous to me, Congressman. We're not talking about the president's plan versus their plan. We're talking about the president's plan versus their repealing the president's plan. They have no plan. They have no alternative way to service these people that need health insurance.
Look, when the president won re-election, the question about any repeal of this program was settled then. What you have is a gigantic lie being told to the American people that they're going to somehow repeal this program. It's not going to be repealed. What they're doing is raising money and getting their base excited, but it has no relevance in the truth. There's not going to be any repeal. The U.S. Senate is not going to repeal it. We just went through a government shutdown. And you know what? There's no reason to repeal it, because I'm proud to be on a team in which 500,000 people have gotten health insurance that didn't have it a month ago. And I'm happy to be on a team in which 50 million Americans who could be denied because of a pre-existing condition can't be denied. And you went through the numbers on seniors who saved $7 billion. And I could go through the laundry list of others who benefited. This is a program that's been being put in place brick by brick over the last 2 years, and almost every American has benefited by it.
And servicing people, Congressman, that were not serviced. See, I think we've got to keep emphasizing these are people that had no health care, had no way in, and they're finally being included, while people are talking about, no, you're just collateral damage for our political fight with the president.
Well, it's phony to suggest some sympathy for someone who's losing their insurance and ignore the 40 million who didn't have insurance. Right. You can't really say that you're empathizing with people who don't have health insurance if you're willing to ignore these people. And I put out a report today from Harvard University that showed 45 million Americans, 2007, before Obamacare, without health insurance, and 45,000 unneeded deaths a year in our country without this program.
45,000 unneeded deaths?
Absolutely.
Wow. Now, Crystal, let me roll these figures at you, because the right wing loves to point out how many people signed up for the insurance plans. You know, they're with the low numbers. But let's remember what happened in Massachusetts with Romney Care. He was their candidate last year.
I've heard of him.
All right. When he was governor of Massachusetts, he had Romney Care. Only 123 people signed up in the first month of the Massachusetts health care law. 123, that's all that signed up. Or just 0.3% of the total who signed up by the end.
Right.
20% signed up in the last month of enrollment. So if they just looked at what happened with Romney Care, the titular head of their party last year, we had less than 1% in the first month, 0.3% to be exact. And in the last month, 20%, because as it gets closer to the due date, that's when people make a rush. It's almost like Christmas shopping.
Exactly, yeah.
So it takes time, and there's a demand. We see a similar trend nationally.
We do, and you know, we all have to be frustrated with the website problems, and I'm sure there were some missed opportunities there, but in terms of being on track for this law to work and for people to sign up by the date they need to sign up, we are still on track to be able to make things work. And even beyond the enrollment number, numbers. You know, Boehner keeps saying, I guess the line from the Republicans is this is a train wreck. Well, we've seen this law work in action in Massachusetts, so we know that the law can work.
Right.
Not to say there aren't going to be bumps along the way, but it is a well-crafted law. What we're seeing of the actual policy, putting the messaging and putting the website aside, the actual policy seems to be working quite well and working as intended. So those are reasons to be encouraged.
Now, Congressman, the de facto leader of the Republican Party, Rush Limbaugh revealed, really, to me, what this is really all about. Listen to this.
The Republicans need to be pushing for total repeal, and they should settle for nothing that helps fix this. They should not, I can't understand even why they would want to be seen as being part of the fix.
Why would they want to be part of the fix? Millions of people need it. Why would they want to be part of fix? Don't do anything to help fix this. I mean, this is just really a game to them, isn't it, Congressman?
Look, you got two teams. It's almost like a football game on Sunday, right? One team is fighting to get Americans health care coverage. The other team's fighting against them getting health care coverage. And there shouldn't be any question about what the people in the stands are rooting for. We should be wanting to live in a country where every single person can have health care coverage. That's the country we've been fighting for 100 years. And now we went through 1 month. And in that 1 month, we've seen 500,000 more on the rolls. And if that was your church, Reverend, where you had 500,000 more people sign up for the rolls, that'd be a pretty good month.
That'd be worth an amen in my church. You know, right. Crystal, Ted Cruz, who really led the charge to shut down the government in an effort to defund health care, he was on Fox News with Chris Wallace. And to show you how just political and, to me, insensitive these guys are, Chris Wallace said to him, with all of the criticism he had, even Republicans was feeding him things, was it worth it? Listen to this.
I literally had top Republicans, unsolicited, offering me research and questions to confront you because they were so upset with you. Simple question. Was it worth it?
Absolutely.
Wow.
I mean, absolutely. Wow. He shut down the government, didn't get the health care law repealed, caused bedlam for 800,000 federal workers.
Right.
And it's worth it.
And threatened the nation with a first ever default, and he still thinks this is great.
I leave the public to judge it for themselves. Congressman Chaka, for time, we'll have to leave it there. Crystal Ball, thank you both for your time.
Thanks, Rob.
Be sure to catch Crystal on The Cycle weekdays at